Hey everyone! Welcome back to Dr. Decode. Today, we're diving into an important health topic, cervical cancer. It's something that affects thousands of women worldwide every year, but the good news is, it's preventable and treatable if caught early. Let's break it down. What is cervical cancer? Cervical cancer starts in the cells of the cervix, that's the lower part of the uterus that connects to the vagina. It usually develops slowly over time and often starts as a condition called dysplasia, when abnormal cells appear on the surface of the cervix. Cervical cancer is a type of cancer that begins in the cells of the cervix, the lower part of the uterus that connects to the vagina. It develops when abnormal cells in the cervix grow uncontrollably. Causes and risk factors of cervical cancer. The biggest cause of cervical cancer. Human papillomavirus or HPV. It's a common virus passed through sexual contact, and most people get it at some point. But in some cases, certain types of HPV can lead to cervical cancer. Other risk factors include smoking, having a weakened immune system, giving birth to many children, and long-term use of birth control pills. Cervical cancer develops in the cells of the cervix, the lower part of the uterus that connects to the vagina. It is primarily caused by persistent infection with certain types of human papillomavirus, HPV, but other factors also contribute to its development. Main causes of cervical cancer. 1. Human papillomavirus, HPV, infection. Most important cause. High-risk HPV types, especially types 16 and 18, are responsible for about 70% of cervical cancers. Transmitted through sexual contact. 2. Persistent HPV infection. While many HPV infections go away on their own, persistent infection increases the risk of progression to cervical cancer. Risk factors for cervical cancer. 1. Multiple sexual partners. Increases the risk of acquiring HPV and other sexually transmitted infections. 2. Early sexual activity. Engaging in sex at a young age increases the likelihood of HPV exposure. 3. Smoking. Tobacco byproducts have been found in the cervical mucus of smokers, and they can damage cervical cells. 4. Weakened immune system. Conditions like HIV, AIDS or the use of immunosuppressive drugs reduce the body's ability to clear HPV infections. 5. Long-term use of oral contraceptives. Some studies suggest that using birth control pills for 5 years or more may slightly increase cervical cancer risk. 6. Multiple full-term pregnancies. Women who have had 3 or more full-term pregnancies may have an increased risk. 7. Low socioeconomic status. Associated with reduced access to screening and treatment. 8. Lack of regular screening, Pap tests or HPV tests. Missed opportunities to detect and treat precancerous changes early. 9. Family history of cervical cancer. Having a close relative with cervical cancer can slightly increase your risk. Symptoms of cervical cancer. Cervical cancer might not show symptoms in early stages, which is why screening is vital. But as it develops, you might notice. Cervical cancer may not cause noticeable symptoms in its early stages, which is why regular screening, like Pap smears and HPV testing, is crucial. However, as the cancer progresses, symptoms may develop. Here are the common symptoms of cervical cancer. Early symptoms. Abnormal vaginal bleeding, such as bleeding after sex, bleeding between periods, heavier or longer menstrual bleeding, bleeding after menopause, unusual vaginal discharge, watery, pink, or foul-smelling discharge, pelvic pain, especially during intercourse, advanced symptoms, pain during urination, difficulty urinating or frequent urination, pain in the lower back, pelvis, or legs, swelling in the legs, fatigue or unexplained weight loss, loss of appetite, constipation or blood in stool/urine, if cancer has spread. If any of these symptoms persist, it's important to see a healthcare provider. Early detection greatly improves treatment outcomes. Prevention and screening of cervical cancer. The best defense? Regular screening pap smears can detect abnormal cells before they turn cancerous. There's also an HPV test for women over 30. Don't forget the HPV vaccine. It's highly effective and recommended for boys and girls starting as young as age 9. Prevention and screening of cervical cancer. Cervical cancer is a largely preventable and treatable disease, particularly when identified early through effective screening and preventive strategies. Here's a concise overview. 1. Prevention. A. Primary prevention. Focuses on preventing HPV infection, which causes nearly all cervical cancers. HPV vaccination. Target group, girls and boys aged 9 to 14 years, before sexual debut. Vaccines, bivalent, HPV 16, 18, quadrivalent, HPV 6, 11, 16, 18, and nonavalent, adds more HPV types. Effectiveness. 90% efficacy against high-risk HPV strains. Safe sexual practices. Use of condoms reduces HPV transmission risk. Limiting number of sexual partners reduces exposure. Health education. Promote awareness about HPV, vaccination, and cervical cancer risks. 2. Secondary prevention. Cervical cancer screening. Aims to detect precancerous lesions early. Methods of screening. 1. Pap smear, cytology-based screening. Detects abnormal cervical cells. Recommended every 3 years starting from age 21. 2. HPV DNA testing. Detects high-risk HPV types. Can be done every 5 years, alone or with pap test. Preferred in women aged 30 to 65. 3. Visual inspection with acetic acid, VIA. Used in low-resource settings. Immediate results, cost-effective. Eye screening guidelines. Start, age 21, pap test. Ages 30 to 65, co-testing, pap plus HPV, or HPV alone. Stop, after age 65, if previous screenings were normal and no high-risk factors. Tertiary prevention. Treatment of precancerous lesions. Cryotherapy, LEP, loop electrosurgical excision procedure, or conization. Reduces progression to cancer if detected early. Treatment options of cervical cancer. If cervical cancer is caught early, treatment might include surgery to remove abnormal cells. In more advanced stages, radiation and chemotherapy are common. Early detection saves lives, literally. Cervical cancer is serious, but it's preventable. Share this video to help someone you love, and don't forget to subscribe for more health tips every week.